if you did your due diligence in trying to plan and save and invest and build for a secure financial retirement, the government actually sort of penalizes you for that from the perspective of healthcare costs.
Peter, very good to see you and welcome back to everyone. Today we're going to talk about the 3 big medical costs that retirees often underestimate. So you probably saw this recently, Peter, but it was a headline in the Wall Street Journal. Take a look. They're writing and spotlighting these 3 major medical costs that retirees tend to underestimate. What it comes down to, if you're retiring soon, you need to budget more for healthcare than you think that you will need. So let's talk through these surprise expenses. Number 1 is medications.
Yeah, Medicare is insurance with typical insurance prices and costs. You've got your copays, you've got your deductibles, and prescription drugs. No different here is that you've got your Plan D or your Advantage plans, whatever the combination is. You still are going to pay for those drug costs. Now, yep. Medicare has certain tiers of drugs and caps on generic prescriptions, but there are some drugs that don't fall into those tiers that, unfortunately, as we age, that's when health events and conditions deteriorate, unfortunately, and sometimes we are on drugs that cost more than we would like to stomach. You're still going to have a cost for those copays, deductibles, all of those normal things.
Mm-hmm. And then next we have what the Wall Street Journal is calling medical isolation, higher costs in areas with limited healthcare access.
Yeah, first-hand account here, personal story. My mom was in an area. She lived out past Belhaven, Bath, North Carolina. If you left her house by boat, there was more population than if you left by car for about the first 30 minutes. She was out there. And not only like the proximity to medical care, but the cost of care in that area was more. And eventually, it wasn't just the medical isolation, but the isolation was not as attractive as it was when, she was a little bit more active and healthy. And she's still very active and healthy, but she wanted to be closer to not only people, but to medical care. And she has now moved, and she's really loving the fact that her doctors and hospitals and emergency care are all like a stone's throw away from her house now, as well as a little bit more affordable pricing for those things because they are in close proximity.
Mm-hmm. All right, next, Peter, this one is the most interesting to me, concierge care. In some areas with large, affluent, retired populations, doctors are increasingly turning away patients on Medicare and accepting new patients only if they pay an annual fee for that concierge medicine. The annual fee averages $3,500 a year.
Yeah, and I know that this Wall Street Journal article was for medical cost in retirement, but this is actually much larger of a trend than just for retirees or those on Medicare. In fact, I'm considering this for myself. My former doctor, my primary care doctor that I went to for years and years, several years ago, actually switched to this model. And at the time, because I was already paying for expensive insurance, I did not follow him to this concierge service practice. However, more and more, I feel like it is something to consider. It's where doctors are not going the way of insurance, not being handcuffed by the protocols and limitations that come with being attached to insurance, and can give their patients more of a concierge type of care. And so this is an additional subscription or cost that you pay to a doctor specifically, that it's like a membership kind of service, and you're entitled to so many visits, or sometimes you get the doctor's personal cell phone number. You can do virtual or in-person appointments, but it is outside of the scope of insurance. And yeah, if you want that level of care, it does cost more, because this is not foregoing the need to have insurance in case there are more catastrophic type of medical events, right? That's always the purpose of insurance, to cover those larger catastrophic type of
Right.
events. We've come to rely on it for more routine health care, but what these doctors in this concierge service are doing is taking the routine care outside and then leaving the insurance only for those larger catastrophic type of events. And again, not
Mhm.
just for retirees. This is something that all ages, I think, across the United States are hearing more and more about. If you have not already heard of it or are taking part, you certainly will, because it is a
Yeah.
growing trend, and something that I am circling back to with that primary care doctor that I had for so long, who provided great care, and looking at a little bit more closely for not only myself but my team here at Richon Planning. So yeah, I
Mhm.
think that's something that retirees certainly will want to explore, or should explore perhaps, and more everybody probably is going to be looking in this, because I think we can all agree insurance is sort of broken and healthcare is sort of broken. So this is a way that doctors and patients are finding kind of a middle ground where it's a little bit more accommodating.
Mhm.
Um, I will also say, Erin, there are a couple things that this article did not touch on that I want to, which is just the cost of routine care. You know, I mentioned those premiums and those deductibles and those copays. Like, that alone is surprising to many retirees. And I forget the exact number, but I saw a stat a few years ago says the average healthy 65-year-old couple over the course of their lifetimes will pay more than like 350,000 or 400,000 just
Yeah.
in routine cost of care. And
Yeah.
then the potential cost of long-term care also was not addressed by this article. And that can be, devastating even to a well-structured financial plan. So we need to account for not only the routine cost of care, those premiums, those deductibles, those copays, but also set aside some money or have a plan to address the potentially catastrophic cost associated with long-term care.
Right. And just to underscore what we're talking about here, healthcare, especially in retirement, is not just about insurance, it is about planning.
Yeah, absolutely. You need to plan proactively ahead of time for, how am I going to address the cost of care? And the fact of the matter is, and what more people are realizing, I think, every day, is that if you did your due diligence in trying to plan and save and invest and build for a secure financial retirement, the government actually sort of penalizes you for that from the perspective of healthcare costs. Taxes are going to be a factor in retirement. That's probably your largest known expense. Healthcare is your largest potential expense. And the fact that we've got these tax deferred accounts can actually cause your healthcare to be even more expensive than it has to be through IRMA. Income related monthly adjustment amount. That means that you pay more each month for your health insurance on Medicare if your income crosses certain thresholds. So if you've got a higher income or you're taking withdrawals from tax deferred accounts, healthcare expenses are going to cost you more, and not just the extra taxes that you're going to have to pay. So this makes things like, healthcare savings accounts, Roth IRAs, maybe that much more of important planning tools when you look at the grand scheme of things, because not only is that going to help you manage some tax-free income, but it also can keep your healthcare expenses and premiums a little lower and more manageable.
Mhm. Well, again, Peter, it comes back to planning. You are consistently used to, again, building these plans for your clients that accommodate these costs and these risks. So if somebody wants to sit down with you to develop that plan, what's the best way to reach you?
Give me a call at Richon Planning. You'll talk to me personally, and I love to hear from people with questions or concerns, or who are looking to complete their plan. Our number is 919-300-5886, 919-300-5886. And when I say complete their plan, a lot of the people that we talk to, a lot of people throughout the area have done a great job in earning an income, saving a good portion of that income, investing and building wealth. But when you look at the 5 pillars that every complete plan needs to address, they've set up their affairs in a way that's going to work against them in several areas. So from taxes to healthcare to legacy planning, and even, creating that income plan once we retire. A lot of people have not specifically addressed that or even had those conversations with their advisor. So that's why we put together what we call the optimized retirement plan, helping people address all 5 of those critical pillars, which we believe everybody needs to have addressed for a sound and confident, lasting quality of life in retirement. So Again, 919-300-5886 is the number to call. You can also email me, Peter@RichonPlanning.com, Peter@RichonPlanning.com. The website is RichonPlanning.com. That looks like Rich on Planning. It's my last name, RichonPlanning.com.
Great. Peter, thank you.
A pleasure, Erin. An important topic. Thank you. Hey folks, Peter Richon here with Richon Planning. So glad that you are enjoying the podcast, Planning Matters Radio. One of the tools that we've put out there that people really seem to appreciate and really are finding of value is at 919retired.com. It is your retirement tax bill calculator. If you've got any kind of retirement account, your tax deferred, 401k or IRA, this is the website, this is the resource where you can go, you can plug in your own numbers, your information, you can slide the tool calculator up and down for your tax rate or your amount of savings and see what your tax bill is likely to be if you default and defer to the IRS's plan versus what you could potentially bring that tax bill down to. A lot of times it is a very significant savings. So if you have not yet, go to the website 919retired.com, run your numbers on the retirement tax bill calculator.
This has been Planning Matters Radio.
The content of this radio show is provided for informational purposes only and is not a solicitation or recommendation of any investment strategy. You are encouraged to seek investment, tax, or legal advice from an independent professional advisor. Any investments and/or investment strategies mentioned involve risk, including the possible loss of principal. Advisory services offered through Brookstone Capital Management, a registered investment advisor.
Fiduciary duty extends solely to investment advisory advice and does not extend to other activities such as insurance or broker-dealer services. Advisory clients are charged a quarterly fee for assets under management, while insurance products pay a commission, which may result in a conflict of interest regarding compensation.